for our listeners who are primarily physicians and APPs and other women's healthcare providers, talk to us about sort of your side of things. Like what are the most common complaints that you're getting? What are the things that you manage the most frequently in your clinic in terms of menopause, perimenopause complaints?
So most of the time it's those patients that, I used to just kind of give a big sigh when I saw the chief complaint coming, that it's like hormonal imbalance or they just don't feel right, So a lot of people are coming in, they just don't feel like themselves. They know that something's off. They may have the more recognizable symptoms like hot flushes and things, and those people are a little bit easier to pinpoint. They may have more of the irregular periods, and that's a little bit more easier to pinpoint too. But so many times it's just I don't feel like myself. I'm fatigued. I'm not interested in my partner anymore. I have more mood swings. I maybe have pains in different parts of my body that I wasn't as, used to having, like in the joints, or I'm getting headaches or, whatever it might be. It's usually like a whole constellation of symptoms. But I would say the most common thing that people are telling me is that I just don't feel right. I just don't feel like myself. I feel like my body's turning on me, or I just don't recognize myself in my own body. And so just like when we have to go through and really tease out what's exactly going on with somebody who's got, chronic pelvic pain or abnormal bleeding, it's the same sort of thing. We have to kind of tease out, okay, well, what do you mean by that? And what is that symptom? And how frequently is it happening? And can you track it with your cycles? And it just takes that sort of careful dissection of the history to get to the bottom of things.